Today, I will be giving you a brief overview of your anti-cancer therapy, how it is given, how it works, and the possible side effects. I will also give you a few tips on how to manage these side effects. Here is a brief overview of the information that we will be covering today. Chemotherapy uses anti-cancer drugs to destroy rapidly growing cancer cells. It may be used to eliminate cancer cells, slow down the rate of cancer cell growth and spread to other parts of the body, or help to relieve symptoms such as pain, which is brought about by the cancer. Chemotherapy may be used on its own or combined with other drug therapies, including hormonal therapy, immunotherapy, or targeted therapy. Your physician will discuss with you your treatment options and prescribe a plan depending on various factors, including cancer type and patient-related factors. As this is the first time your body receives these new medications, please alert the nurses if you experience any signs of an allergic reaction, such as face swelling, significant rashes, shortness of breath, or feeling unwell. Any pain, redness, swelling, or discomfort around the injection site. This would ensure that the nurses can attend to you promptly to relieve these symptoms. If they occur after you leave the hospital premises, please call the clinic for advice or proceed to the A&E after office hours. Chemotherapy can affect the healthy cells in your body, causing unwanted side effects. Healthy cells in certain parts of the body, such as the bone marrow that produces your blood cells, and the digestive system, example the stomach, are especially sensitive to chemotherapy medications. This is why certain side effects, such as the risk of infection, nausea, and vomiting are more common. Other side effects may include hair loss of appetite, mouth ulcers, alteration in taste, numbness of hands and feet, diarrhea, and constipation. However, the severity of these side effects vary depending on the type of medication and doses you receive, and hence you might not experience all of them. Most of these side effects will go away gradually when the treatment is over. We will now go through some of the more common side effects and how they can be effectively managed. Chemotherapy can reduce the number of blood cells made by the bone marrow, such as red blood cells, platelets, and white blood cells. You may require a blood test prior to each treatment to check that the number of cells in your blood are of an acceptable level. We will now tell you more about the different roles played by these blood cells and what could happen if they are low. White blood cells are important to help the body fight and prevent infection. If the number of white blood cells is low, you are more likely to get an infection. With fewer white blood cells, the body can't protect itself from infection. Your resistance to infection is usually at its lowest 7 to 14 days after chemotherapy. The number of your white blood cells will then increase steadily and usually return to normal before your next cycle of chemotherapy. Platelets are cells that help blood to clot and prevent bleeding and bruising. If the number of platelets in your blood is low, you may bruise easily or bleed more than usual for minor cuts. Red blood cells help to carry oxygen to all parts of the body. If the number of red blood cells is low, you may feel tired and lethargic. You may also become breathless and feel dizzy and lightheaded. To prevent infection, it is important to practice good hygiene. For example, keep clean and shower daily. Always wash your hands thoroughly after using the toilet and before preparing food. Practice good oral hygiene and keep your mouth clean. In addition, stay away from crowded places and from people who are sick. When having meals together, Practice good table manners and use a separate spoon to serve food so as to prevent others from spreading the infection to you. You should also wear a mask when going out to protect yourself from infection. It is important to make sure that your food is thoroughly cooked and avoid raw food, half-boiled eggs, or medium rare meat, as germs might be present. In addition, food should be freshly prepared and best eaten within 1 hour after cooking, as it may be exposed to germs in the air if left out for too long. Avoid eating overnight or moldy food. If eating overnight food cannot be avoided, food should be properly stored in the fridge and consumed within the next day after reheating thoroughly. If possible, remove skin from fruits and vegetables before eating or juicing them. Make sure you boil your water before drinking, even if you are drinking filtered water. Avoid drinking alkaline water while having chemotherapy, as it may affect the absorption of medications. Fever may indicate an ongoing infection. If you feel feverish or unwell, measure your temperature with a thermometer. If your temperature is 38 degrees Celsius and above, or having symptoms of an infection such as chills, shivering, cough, cold, or sore throat, visit the A&E department immediately. Do not self-medicate with paracetamol or when you have a fever, as it can lower your temperature and hide the signs and symptoms of an infection. However, if you have occasional aches or pain, you can still take Panadol for pain relief, but remember not to take it for fever. If you feel unwell with a normal temperature, or have any signs of an infection such as those mentioned above, please contact the clinic during working hours or visit the A&E department after office hours. As chemotherapy can lower your platelet counts, here are some things you can do to prevent bleeding problems. Try not to bruise, cut, or burn yourself, and be careful to avoid bumping into things or tripping. Clean your nose by blowing gently. Do not pick your nose. Brush your teeth gently with a soft toothbrush to protect your gums from bleeding. You may continue to floss. However, stop flossing if it causes pain or bleeding from your gums that do not stop. Be aware that bleeding may take a longer time to stop. If you experience any unusual signs of bleeding, such as large amount of fresh blood in your urine or stools, black sticky stools, or significant and/or multiple bruising, please proceed to the A&E department. Chemotherapy may also lower your red blood cells, which can cause fatigue. Fatigue is a feeling of tiredness or lack of energy. It is the most common symptom that people with cancer experience. The amount of fatigue, how often it happens, how long it lasts, differ for each person. Some signs of fatigue may include feeling weak or tired. It may be physical, emotional, or mental tiredness. Your body, especially your arms and legs, may feel heavy. You may have less desire to do normal activities like eating or shopping. You may also find it hard to concentrate or think clearly. Some things you can do to manage your fatigue include trying to reduce daily activities that you don't really need to do. For example, you may want to ask your family and friends to help with grocery shopping or household chores. Making sure you get plenty of rest. It is also important to do some light exercise, such as short walks or more if you feel up to it. This will give you more energy and helps to keep your muscles working. Avoid driving or operating machinery if you are feeling tired. If you are having difficulty sleeping, please inform your doctor. The tiredness will usually get better once chemotherapy is over. However, it can be 3 to 4 months or even up till a year before you feel back to normal. Chemotherapy can cause mouth problems such as a sore mouth and throat, mouth ulcers, or thrush infection, which may look like white spots on your mouth and tongue. These problems usually occur 5 to 7 days after chemotherapy. Thus, it is important to practice good oral hygiene from the start. Some good habits you can practice include brushing your teeth gently twice a day and after meals using a soft toothbrush. If you have dentures, brush them after meals and soak them in denture solution overnight. It is also important to gargle your mouth regularly with salt water or alcohol-free mouthwash. If your doctor prescribes a mouthwash for you, use it as prescribed to prevent soreness. You may also wish to visit your dentist before the start of chemotherapy. If you need to have dental procedures done while on treatment, please inform your dentist that you are on chemotherapy. A sore mouth or mouth ulcers may make eating and drinking uncomfortable. You may purchase ulcer gels from retail pharmacy to soothe the ulcer. In addition, you may also keep your lips moist by using Vaseline or lip balm. You can also consider adding gravies and sauces to your food to keep them moist and make swallowing easier. Chemotherapy can also affect your sense of taste. You may find food more salty, bitter, or metallic. This will usually return to normal after chemotherapy finishes. It is best to avoid or cut down on smoking and excess alcohol intake while on chemotherapy. Avoid hot and spicy food if you have mouth ulcers or stomach discomfort. Some chemotherapy drugs can make you feel nauseous or even vomit. However, not all drugs will cause this feeling, and some people do not feel nauseous at all. There are some very effective treatments to prevent and control your symptoms. If your chemotherapy is known to cause vomiting, you will be given anti-vomiting medicine before the start of your chemotherapy. You will also be given tablets to take at home afterwards. Take these regularly and as prescribed by your doctor, even if you don't feel nauseous. This is because it is easier to prevent than treat vomiting. If you have no appetite as you are feeling nauseous, please try eating small frequent meals instead of 3 large meals a day. Avoid eating fried, fatty, oily food or food with a strong smell. When you are drinking liquids, try drinking them 1 hour before or after meals instead of together with meals. This helps to reduce bloating and chances of vomiting. You may also sip small amounts of fluids throughout the day. To reduce nausea, eat dry food such as toast or crackers or suck on a sour candy. Ginger can help too, such as ginger tea or ginger biscuits. You may also try distracting yourself by doing things you enjoy such as reading, listening to music, or watching television. If you do feel nauseous, do not lie flat immediately after meals. Wait for about 30 minutes before lying down. Proceed to the A&E if the vomiting significantly reduces your food and drink intake despite taking anti-vomiting medication, as it may lead to dehydration. Hair loss may begin 10 to 21 days after starting chemotherapy. It is not limited to the scalp and head, but hair from other parts of the body may also fall off, such as eyebrows, armpits, or private areas. Some medications do not cause hair loss but can make it thinner. You might notice your hair becoming more dry and brittle. Looking after the condition of your hair can reduce the chances of hair loss. Remember that hair loss is temporary, and your hair will grow back gradually when the treatment stops. New hair may grow back with a different color or texture. Avoid dyeing or perming hair while having chemotherapy. When hair loss occurs, avoid using high heat when drying your hair or brushing it with too much force. Use gentle hair products and pat hair dry after washing instead of rubbing it. Some patients may choose to cut their hair before starting chemotherapy. You may also want to prepare a wig, scarf, or hat to protect your scalp from the sun when going outdoors. Some chemotherapy medication, anti-nausea medication, and painkillers can cause constipation. If you experience constipation, try to eat more high-fiber food such as prunes or green leafy vegetables, and drink plenty of fluids, unless advised otherwise by your doctors to restrict fiber or fluid intake. Keeping yourself physically active through light exercise, such as short walks, can also help to reduce constipation. Some chemotherapy drugs can affect the cells lining the intestine, resulting in diarrhea or loose stools. If you have diarrhea or are passing out large amount of loose, watery stools, it is important to stay hydrated. Make sure you drink plenty of fluids, up to 2 liters a day, to replace those volume that were lost with diarrhea. Avoid food that worsen diarrhea, such as milk, dairy products, and high-fiber foods. You may resume eating them when your diarrhea has improved or resolved. Some chemotherapy drugs may affect the nerves in your hands or feet. This can cause tingling or numbness, a sensation of pins and needles, or weakness. Take extra care to avoid injury and inspect your hands and feet for wounds or cuts. You may also wish to wear gloves and socks to keep your hands and feet warm, as it improves your blood circulation. It is important to inform your doctor if the numbness affects your daily activities, like buttoning up your shirt or picking up objects. In such cases, your doctor may need to review the choice of medication or adjust the medication dosage. Usually, these symptoms gradually get better when chemotherapy is over, but in some cases, it may be permanent. Some chemotherapy drugs such as capecitabine or 5-fluorouracil may cause hand-foot syndrome, where the palms of the hand and soles of the feet may peel, become dry, itchy, red, painful, or swollen. These symptoms usually get better when treatment ends. Applying moisturizer liberally twice a day may help to prevent this side effect. When going outdoors, try to avoid exposing yourself to direct sunlight by wearing long sleeve shirts, carrying an umbrella, or applying sunblock. In addition, avoid tight-fitting shoes or rubbing pressure to hands and feet. Inform your doctor if there is severe pain or blister formation. Now, we will move on to cover some general lifestyle measures to note while on chemotherapy. Firstly, please avoid herbs, traditional Chinese medicines, jamu, and supplements, as they may potentially interact with chemotherapy medications. If you are keen to start on new supplements, please seek your doctor's or pharmacist's advice before you purchase them. It is also better to avoid consuming products containing live bacteria, such as yogurt, or probiotics, such as these may potentially cause an infection when your immunity is low. Eat a well-balanced diet, and getting adequate nutrition is important, as it helps you to maintain your weight and energy level, improves your treatment tolerance, increases your immunity, and lower risk of infection. You may consider adding high-protein foods such as minced meat, fish, eggs, and tofu in your meals. Avoid replacing your meals with clear soup, as they contain low amount of nutrients. Most importantly, drink at least 2 liters of fluid per day unless informed by your doctor to restrict fluid intake. This will decrease your chances of getting constipation and prevent dehydration. If you are taking any chronic medicines, continue to take them unless informed by your doctor or pharmacist to stop. If you need to go to the hospital for any reason other than cancer, inform the doctors and nurses that you are currently on chemotherapy. If you need any dental treatment, discuss with your cancer doctor first. Similarly, inform your dentist that you are currently on chemotherapy when you visit them. Light exercises will be good for you as it helps improve your mobility, balance, and emotional well-being. Avoid strenuous exercise and rest when you are feeling tired. Stay positive. Understand your condition and take an active role in managing it. Do not be afraid to discuss your concerns or worries with your doctor, pharmacist, nurses, and family members. Repressed feelings can be harmful to your immediate well-being and long-term health. Lastly, we will end off with a summary list of the signs and symptoms that requires a visit at the A&E immediately. We may have mentioned some of these points earlier in the video. Do not worry that you are unable to remember all these points now, as you will receive a similar handout on signs and symptoms to visit the A&E from our pharmacist later on. Thank you for your kind attention. We have reached the end of our video. If you have other questions, do clarify them with your oncologist during your appointment or speak to our pharmacists and nurses at the chemo room. Otherwise, you may also contact us via the contact details given to you by your respective clinics during office hours.